We've learned of an urgent warning tonight for parents concerning the H1N1 flu. With so many children now coming down with the virus, doctors say you need to know the warning signs just in case, so you can tell when a case becomes life-threatening. Here are some of the symptoms that can be signs of very serious trouble in children. Bluish skin color, a lack of thirst, fast or troubled breathing, and a slight improvement that's followed by a return to fever and coughing. Parents, you should seek immediate help if you do see these particular signs. And there are also new concerns tonight about whether emergency rooms are prepared to handle the crush of flu patients that they could see this winter. A new report is predicting a rather grim scenario. The scenes in Tennessee and Texas last month were stunning. Tents put up outside hospitals to treat the sudden increase in suspected H1N1 cases.
It is very crowded and chaotic in there.
We're just busy, very, very busy.
A new nationwide poll shows nearly 90% of emergency room doctors are worried about their hospital's ability to handle a surge of patients.
It's a challenge because we are really at full capacity without any significant number of flu cases.
In Boston hospitals, they've been preparing for months, stocking up on supplies like ventilators and cross-training employees.
We're right now not thinking tents, but we are thinking that we could use different areas of the hospital for a similar purpose.
That's what Boston Medical Center did last spring when the H1N1 pandemic began, turning part of its pediatric ER into a special treatment area for the many H1N1 patients. And it doesn't stop there. An editorial in the Journal of the American Medical Association urges hospitals to have policies to determine who will and will not receive life support if there aren't enough staff or equipment to care for everybody.
We shouldn't be complacent about the issue, that we have to do everything we possibly can to get pandemic preparedness in place so that if we have a worst-case scenario with the H1N1, at least we'll be prepared to deal with it.
This is the good news. We're probably much better prepared in Boston than in most parts of the country, but right now, most of the cases that are being seen are mild, and even optimists say if a lot of children and adults become seriously ill, even the best medical communities could become overwhelmed.